Hello and welcome back to our DAF channel. Today we have Dr. Westman again, and today we're going to be talking about why a keto or low carb diet is so powerful for so many different reasons.
It really is that powerful. I guess if you're just otherwise healthy and you try a keto diet, you can feel it powerful because it makes you less hungry and it gives you more energy. Which is one way that it's powerful. But as a medical doctor treating medical conditions, it's also powerful to treat conditions like obesity, diabetes, polycystic ovary syndrome, fatty liver, heartburn. So it's actually as powerful as many different medications all at the same time. So keto is powerful because it's simple, and I guess simple and strong. Isn't that the definition of power?
Yeah. So what do you typically see? What is the number one, or maybe the top three kind of conditions that you see in your clinic?
Well, most people come to me as a medical doctor, keto doctor, or obesity medicine specialist. It's all pretty much the same thing, to treat either obesity or type 2 diabetes. Those are the most common things. But you'll see the heartburn goes away in just about everybody.
Let's go back to the diabetes
Sure.
for a second. Would you say that a keto diet, what's the success rate that you have in your clinic?
For diabetes.
For type 2 diabetes.
For type 2 diabetes, and success rate, meaning you take someone off the medicine.
Right.
Their hemoglobin A1C or their blood sugars are normal.
Right.
And they're also losing weight as a percentage. So my prediction is that given enough time, just about everyone will be able to be reversed in terms of diabetes. So, but what I see in my clinic, if someone has 200 pounds to lose and they're on diabetes medicine and they've lost 100 pounds, they may still be on that medicine, but their journey is actually one that has to continue. So let's put it another way, someone only has 10, 20 pounds to lose and the weight is contributing to the diabetes, and they're eating lots of carbohydrates. I would say that it's 100%. We can put diabetes into remission, and then if you're in remission for 5 years, that's the definition of a diabetes cure.
Right. So this is obviously something that you see. You've been in your clinic has been going on for what? Going on 10 years now?
Well, 13 actually,
Okay.
but and that's after
this,
10 years of clinical
right.
research.
So I have perhaps a controversial question to ask, and that question is, I've seen it. There's so many stories about type 2 diabetes being put into remission. Why do the diabetes associations around the world still prescribe carbohydrates at every meal?
Yes, and it makes no sense based on the underlying reason for diabetes. Diabetes is a disease or a problem of high blood sugar. So why would you want to drink sugar or eat sugar, right? So in fact, 100 years ago, the organizations did endorse a low carb diet.
Okay.
And so something happened along the way where it was forgotten, or some people think that the medication treatment took preeminence. And then if an endocrinologist, diabetologist doesn't understand that it's the underlying weight that's also contributing to it, if they don't address the weight, then you'll never be fixed with the diabetes. I mean, you'll always have diabetes. So getting back to your question of why do they preach carbohydrates, I think there's a couple reasons. One is there's a false belief that medications will fix it, or that diabetes, type 2 diabetes, requires medication therapy. That's not true. So on the medical doctor side, they think that, oh, here's diabetes, I need to give a medicine. But on the dietary side, actually the diabetes educators are taught to push carbohydrate so that the blood sugar doesn't go too low. But when you think about it, the diabetic educators who are telling people to eat carbohydrates are seeing the patient after the doctor has put them on a medicine that can make the blood sugar go low.
Right.
So, and I've met dietitians and diabetes educators who, rightly so, they say they're saving lives by making people eat carbohydrates. But that's only because the doctor put them on a medicine that can make the blood sugar go too low. So what we do is we take control of the medicine and the food, and we lower the insulin or the medication for diabetes and the carbohydrates at the same time. And so then you don't have to eat the carbohydrates, because the blood sugar won't go too low unless you're taking a medicine that makes it go too low. So it's kind of complicated, right?
But that makes sense. And the interesting question would then be, do you think that the tide is changing? Do you think that in the future you're going to find diabetes associations advising people, or giving them the choices at least? You can either take the medication and eat the carbs, or not take the medication and not eat the carbs.
Well, things are changing. You know, it's slow, but I think the more publications, the more studies that are in regard to diabetes and low carb or keto diets, yes, those will be incorporated in the guidelines. But I think what's going to happen is there will be some guidelines that are driven mainly by the pharmaceutical industry, and they'll be medication focused. There has to be new guidelines, or maybe even new organizations that understand that there's more than one way to go about it. So I wouldn't expect an association that is mainly funded by a drug company or drug companies to say anything other than use drugs, right? So giving the individual doctor has to understand, and the individual consumer, the patient, has to understand that these guidelines are not purely driven by science and the best interest of the patient. So you have to look at who's funding these associations, and today most of the diabetes associations are largely funded by the pharmaceutical industry.
Well, that's very, very interesting, and I think the take-home message here is, if you're watching this and you do have type 2 diabetes, that there is a choice for you. And those two choices are, you could either take the medications and continue to eat the carbs, or you could find a doctor that understands that if they take you off the carbohydrates and they monitor you, they're able to lower your medication, and then you're able to eventually either get off the medication or to really be on a very, very small dose of medication.
Absolutely.
Well, thank you very much. If that was helpful, please share and like our videos. We appreciate all the support. Thank you so much.
Thank you.